Good morning. Good morning students. Today we are going to learn about chairside investigations. And you all must be knowing about the history part we have already covered, and history leads to some things in our mind. For that, to clear those doubts, we go for chairside investigation. So today's topic is chair side investigation. So, what you understand about chairside investigation, which we do in the clinic during our interaction with this patient, when the patient is still on the chair, on the dental chair, patient is sitting. We have interacted with the patient. We have come to some conclusion to justify that we do a chairside investigation. Now, what all the various important investigation which are required for diagnosis, for the treatment plan and action which will be taken after we have come to confirmatory diagnosis. So, what are chairside investigations? To name some, we will like to, that is dental caries detection. So there are many methods of seeing the dental caries. First is probe method, visualization method, probe method. Then we'll come to some methods like those are laser detection, percussion, pulp. If we detect that pulp may be involved, then pulp vitality test. So this is another caries detection. Then sometimes we think that root might be broken. So that time we diagnose tooth fractures. So detection of tooth fractures. Then we also do some type of this was a hard tissue. For soft tissue, what we do? For soft tissue, we go for if there is some swelling, that time we go for bimanual palpation. Or we go for diascopic investigations, that we put a slide and with that we test the blood flow, that is diascopy test. If we suspect there is a pain, we want to go which area, which nerve is producing pain, that time we go for nerve block test, that is nerve block test. In that what we do? We give a block, mandibular, maxillary, trigeminal, which all mostly it is used in trigeminal pain. That time we block the trigeminal nerve and we see if still pain is there. If still pain is there, that means that nerve is not involved. So we go for diagnostic nerve block test. Then if we are going for some can we think of some oral carcinomas, or we think of some, just to detect it is malignant, or we want to see if it is not malignant, or we say that time we do go for culture test. So cytological culture smear has to be taken, and there are n number of tests, that is salivary flow test. In saliva we detect so many things, but that will be in lab. But on the chair we can see salivary flow test. How much saliva is there, thickness of the saliva, salivary color, salivary, how forcefully it is coming out, how, if we can see the saliva end posting from there, how much saliva is coming out, that we do with a lemon test, that we call lemon test. We put a small drop of lemon on the salivary ends, and there if it oozes out, that means there is no blockage in that salivary flow. So that is also done. So many tests are done on the chair side, like Visilite test. So Visilite, there are two blocks in that, we just mix it and we place it, and color changes. If there is keratotic lesion or malignant lesion, there will be a dysplasia is there, so that color will be changed. That kind of we do toluidine place, we'll come later. First thing is visual inspection. How we do visual inspection? Systemic observation of the patient. Patient is sitting, if there is swelling, if there is an ulcer, anything, we do a systemic observation. Visual inspection of skin, mucous membrane, yield information, color changes and dryness, edema. So three things we see for color changes, edema, swelling. These things we see, and the color of the mucous membrane, thickness of this, that also is seen. But this is all visual inspection. Then we will go for palpation. Like when we go for palpation, we think examination by touch. It helps the oral physician to evaluate the deeper structures which are not visually seen, and we can, that comes with like so many patient experience, that touch, that feel, how you feel that this is wood, this is plastic, that kind of thing comes by touch, and that consistency, scrapability, your fixity, it is all seen there. So that time we think that how difficult it is in starting, but later on by touch we can already tell that this is keratotic lesion or this is not. So that comes by nerve endings or our nerve endings. So that can be very well appreciated. There are three types of palpation. One is bilateral palpation in the same, then bidigital, both two fingers are used, then bimanual, two fingers of different hand. That is palpation done by three methods. It is not it is just by manual palpation. No instruments are used in this kind of palpation. Then comes the probing method. In probing method, most of the intraoral examination is carried out by probing. Probing helps to detect carious lesion, estimates the amount of periodontal destruction, and tracks the sinus tract. If there is a sinus tract that is leading from somewhere in the tooth region, and there is a soft tissue, and this sinus is leading towards the alveolar mucosa. So how we are going to, we have to put a gutta percha point, and that gutta percha point will, and then we take a radiograph that tells us how much sinus it is, from where it is coming. Sometimes sinus opening is far with the other teeth, and sinus is with the caries is other teeth. So deeper inside that sinus tract has travelled, and that is detected by GP point, and that GP point is placed and a radiograph is taken. that time we come to sinus pain. It also tells us how much periodontal destruction is there. If there is a teeth, how much periodontally destruction, we put a probe inside and that will tell us how much deeper that periodontal probe has the marking on it. That will tell us how much deep we are going, how much bleeding is there when we probe. That is also detected in a probing method. So you must have understood the palpation. Now we lead to when we go for probing. There are how many methods of probing? There is a straight probe, there is a curved probe, there is a periodontal probe. So these are different probes and used in different places. When we feel it is a periodontal, that time we use periodontal probe. That time if you feel there is something calculus is there, you want to remove it, that time don't use periodontal probe, it will not help. That time you have to use a curved probe. Then comes the percussion. Percussion, you will stand, it's like hammering with a percuss. So to identify the tooth, that sound will tell us it is attached to soft tissue or it is attached to hard tissue. That means tooth is ankylosed. Or that percussion will tell you how much pain is there. If there is a pain, a person will blink. If there is no pain, only the patient was feeling that there was a pain, that time patient will not feel. But if you ask, first you percuss and then you ask, then patient will definitely going to tell you there is a pain. So don't depend on the patient here. You have to decide yourself how much pain is there and how you are going to percuss. That percussion is not that you have to put a hammer like that. That small bits will be there, and that will later on think that it will also come with experience. In the first patient, we see that a new student just come and start percussing. So that is not the correct way. Small percussion is there, and that will your hand will be very much accustomed to do that. So when there is a percussion and there is a pain, that means yes, there is something below the tooth, that is soft tissue. And if the percussion voice is, you will feel that it is coming from the bone, that means tooth is ankylosed. Then percussion can be used to clinically assess if tooth in question is acute periapical infection or chronic periapical infection. If it is acute, the pain will be too much and it will be unbearable. That means it is in the acute condition. Maybe a chronic condition has aggravated and it is acute. So that makes a difference. Here you can decide the treatment plan of this. The drug has to be given or it has to be opened at once. That has to be decided here. Then comes the transillumination. Transillumination. Trans, you understand two places. Illumination, illuminated. There is a, we put a light and then we can see if there is some blockage, if there is some which is not letting the light to pass, that time we detect something is there. So this is also a method. Then comes the auscultation. Auscultation is done by like in dental we use for stethoscope in the area of swelling and in TMJ. Two places we use auscultation. Medically we use auscultation to see the lung, to see the, but here in dental we use it for TMJ. Auscultation is done to detect the noise in TMJ. If some it is not normal, if clicking sound is there, and when there is a swelling, that time we detect if there is some pulsatory or it is something related with like in hemangiomas, it is related to vascular lesions are there, that time auscultation is used. And now we'll come to pulp vitality test. Pulp vitality test is widely used as diagnostic aids in assessing the status of dental pulp. Uses prior to operative procedures. Health may be in question. Post-trauma to the pulp and assessment of anesthesia. So when you give anesthesia, at that time also you check the pulp vitality. If the pulp is in question, a trauma is there, you don't know if pulp is healthy or pulp has is damaged. So that time pulp vitality test is done. There are many types of pulp, one is thermal test. In that we use eye sticks. We place eye sticks on the normal teeth and then on the questionable teeth, and you will feel the difference. There will be a slight pain in the normal teeth. That difference will be measured by the both. Then there can be a carbon dioxide snow also is used to detect. This is also a thermal test. And then we can use electric pulp testers are there. In that we put a electrode is attached, and we just put a carrier transmotor, and then we use it. We put on the affected teeth and then on the non-affected teeth of the same side, and you can also use the second side. And if you are not very much confirmed, then you can use the other maxilla or mandible. And that time, if it is you say it is 5 in the questionable and 8 in the normal, that means questionable teeth is pulp has damaged. So that is done. And here also we have to be very careful that it should not be too long, so patient will have electrical damage of the pulp. So that kind of thing has to be taken care of. Then we come to toluidine blue test. The use of toluidine blue, toluenium chloride dye, is used as a mouthwash, and we can apply also. So it is just to see the margins of the any soft tissue lesion, or we want to see from where we have to take the biopsy. For that reason, toluidine blue test is done. And it is very important to detect this margins, so the best place to do the biopsy. So before any procedure of biopsy, this is done. In dental, like in dentistry, it is very much used. We do the toluidine blue test, and that area will appear dark blue, and the area which is not like dark blue, that means it has not uptaken. There is no dysplasia in that region. That is also a test. Then Lugol's iodine test is also there. It is retained, Lugol's iodine is retained in the squamous cells, but it is not in dysplastic or malignant cells. So by that we can see which can be a malignant area, which can be a normal area, just to detect the things to go further. Then there is a Visilight. It is a non-toxic chemiluminescent light that it shine in the mouth, that area which is almost very powerful detection of biopsy proven squamous cell dysplasias, which is not seen by the naked eye. Then there is a Veloscope. Veloscope is handheld device that can enhance the visibility of normal oral mucosa, and it is known as autofluorescence. So that is also a type. And diascopic test is done mostly we can see in mucosae. We put a slide, and when we will press it, blood will flow out of the area, and that area will be slightly pale, and that is diascopic test. That means some vascular region is there that leads us to thinking of hemangiomas or mucocele or some non-vascular or hemorrhagic. Then there is a shimmer test. Shimmer test is mostly done to evaluate the tear protection. The test consists of placing a small strip of filter paper inside the lower eyelid and conjunctival sac, and the eye are closed for 5 minutes, and then remove the amount of moisture is measured. Then 5 mm is positive in SS. If it is 5 mm, that means it is positive shimmer test. So that is also done. Then silometry. Silometry is a very important aspect of dentistry nowadays, because there are many things which we detect by saliva. So like blood, previously it was a blood and now it is saliva. So salivary flow, how much saliva is flowing? If it is less, can we call it to Sjogren syndrome? What can be the regions? The test should be standardized. There should be a whole saliva is collected for 15 minutes and positive when less than 1.5 mm of saliva is collected. That means there is Sjogren syndrome. So these kind of tests are done, which are very important in dentistry, and that is also like it makes us, paves our way to see that it is done only just for the founding the place to go for higher tests. So this is the class just for make you aware of these small tests which are done chairside. In the next class we'll be taking up the test individual for oral mucosa, for salivary gland, for other reasons. Thank you.